With more than 1 in 3 people in the UK developing some form of cancer in their lifetime and a sufferer diagnosed every 2 minutes, cancer touches us all. Current treatments such as chemotherapy, radiotherapy and surgery all exist with varying rates of success. These treatments are infamous for their severe side effects and reduction in the patient's quality of life. The focus is now shifting towards boosting our own immune systems. Despite popular belief, our immune system puts up a pretty good fight against cancer on its own. There are 3 main cell types involved in your immune response: antigen-presenting cells, B cells, and T cells. On the surface of cancer cells are specific proteins known as antigens. These act as flags identifying the cell as cancerous. These antigens are engulfed by the APCs and expressed on their surface. The APCs then move to the lymph node where they activate T cells, enabling them to move to the site of the cancer cells, where they help to kill it. Here is a T cell in action. T cells also activate B cells, which secrete small proteins called antibodies, which are specific in shape to the antigens. These antibodies direct other immune cells to the site of the cancer. Some cancerous cells are able to evade these attacks and hide themselves from the immune system due to specific mutations. It is these cells which are able to grow and divide and ultimately lead to cancer. Scientists are now harnessing our immune system in the fight against cancer. This novel treatment is called immunotherapy. One form of immunotherapy is the use of monoclonal antibodies. Antibodies are produced naturally in our bodies and bind to targets on cell surfaces. Here, they send out signals to recruit immune cells to destroy the target cell in a process called apoptosis. A range of therapeutic antibodies have been developed to specifically target the immune system, with the University of Southampton at the forefront of this research. Ipilimumab is a monoclonal antibody currently in use which targets a protein found on the surface of T cells called CTLA-4. When activated, CTLA-4 suppresses T cell function, blocking the immune response. Ipilimumab specifically inhibits CTLA-4 function, allowing an immune response in cancer cells to be destroyed. KYLOB is another monoclonal antibody and is being developed at the University of Southampton. It turns on inactivated immune cells to drive an immune response. KYLOB targets a protein found on the majority of APCs, CD40. APCs are activated when T cells bind to the CD40 protein. Cancer cells can suppress the amount of T cells in our immune system, which in turn leads to a reduction in APC activation via CD40 and reduced cancer killing. KYLOB works by mimicking the binding activity of T cells to activate CD40 APCs, causing more APCs to be available to kill the cancer cells. KYLOB is also able to kill the cancer cells on its own. These 2 antibodies work in different ways, with ipilimumab releasing the brakes on the immune system and KYLOB pushing the accelerator. Rather than targeting the cancer itself, like chemotherapy or surgery, antibodies are focused on boosting our own immune systems. This reduces the severe side effects as seen with current treatments and is much less invasive. The major downside of monoclonal antibodies is their production cost. A single course of therapy can cost anywhere between $20,000 and $80,000. So, what are the next steps? Monoclonal antibodies have been proven to be successful in some cancers. However, we don't know if antibodies work in all types of cancer or why not everyone responds to them, and scientists are trying to find out why. Other types of immunotherapy include vaccines, blockers of cancer growth, and anti-angiogenics, which starve the cancer. The fight against cancer is one that we're all involved in. The power to kill cancer is in each and every one of us. All we have to do is harness it.